8:43, good morning, AM 1430 KRGI, 105.5 FM. I'm Brian Gallagher. We have a guest in studio today from Central District Health Department. Nicole Placke is here. She's the Community Health Manager, and we're going to talk about guys. And the reason is it's Men's Health Month. And let's face it, guys, sometimes there's a few things we need to learn, so I'm ready to listen. Go ahead.
Where do we even start?
I don't know. Where should we start, though?
There's so much we could talk about.
Okay.
Well, my specialty at the health department is immunization, so I guess we'll just stick to that today. The first thing with it being summer, people should be thinking about tetanus. So I think when people think about tetanus, they think about stepping on like a rusty nail. However, you can get tetanus from dirt, dust, things like that. So if it's been 10 years or more since your last tetanus vaccine, should definitely be thinking about getting one.
I either need to get a shot or a new excuse. Okay, well, we know that happens. But, I mean, are there other immunizations that guys should be aware of?
Definitely. So I think one that men don't often think about is the HPV vaccine, which typically presents cervical cancer in women. However, men can carry this virus and transmit it to their female partners. So anybody 45 or younger can get this vaccine.
Okay, so I'm beyond that age threshold, and we'll just leave it at that. How about for those of us who are in that world of the beyond?
Beyond. So just your typical ones. I know it's summer, so we're not thinking flu or things like that. But I would just check with your provider that you're up to date on things like pneumonia. Maybe even just looking ahead and having those conversations about, are you eligible for a RSV vaccine this fall? And start planning now for those things that will come in a few months.
Well, I can honestly say I was up to date on all of the COVID shots, okay? And I'm one of the few that never had to deal with the symptoms. So I think they worked, okay? For years, I've gotten the flu shots. And so I think my immune system has been built up over time. But let's face it, as the years advance, I know there's new cooties out there waiting for me just saying, okay, Gallagher, we know you're coming. So it's good for me to know, too. And with my regular doctor checkups now, these are the things that we do talk about. So I'm all ears. I mean, these are things, and I'm doing this on purpose because, guys, I do want you to listen too. Let's face it, we just think, oh, I'll be okay. Oh, it's no big deal. It can be.
Precisely. Exactly.
So you have a record of the shots as long as, especially like the COVID shots where I went through you guys and made sure, so I've got the card that's got all of the dates and stickers and all of that on there.
Yep, so if you're not sure when your last vaccine was, whether it's COVID or a tetanus vaccine, you can definitely call our office and we can access those records for you.
But otherwise, check with your healthcare provider.
Exactly.
And make sure. So it is Men's Health Month. It's a good idea to make sure that you are up to date. If folks have a question, how do they reach out for more information?
Give our awesome staff a call. Our number is 308-385-5175.
Nicole Placke is the Community Health Manager for Central District Health Department. Thanks for the update.
Thanks for having me.
Good morning from AM 1430 KRGI 105.5 FM.